Hello, and welcome to Diagnosing the Barriers, a podcast by Physicians for Human Rights Israel. I'm your host, Haya Abwardi. In PHRI, we work to challenge systems of oppression and dispossession and to ensure the full right to health to all people living under Israeli control, regardless of nationality, legal status, or identity. Through medical care, documentation, legal advocacy, and public engagement, we stand alongside marginalized communities, including Palestinians in the occupied territory, statusless individuals, prisoners and detainees, and those living in Israel's social and geographic periphery. In this podcast, we bring you voices from the ground, PHRI staff, volunteers, and partners, as we explore how health intersects with power, inequality, and resistance. We'll take you beyond headlines to understand the real-life barriers to health and the collective struggles to overcome them. Today, we're speaking with one of the authors of a report published by PHRI, Maha Loulou. The report, titled Unlawfully Detained, Tortured, and Starved Gaza's Medical Workers in Israeli Custody, investigates and documents systematic violations endured by Palestinian healthcare professionals arrested since October 2023. Drawing on structured interviews with over 24 detained medical workers, including doctors, nurses, and paramedics, PHRI exposes harrowing allegations, forced disappearances, severe physical abuse, sexual violence, medical neglect, and starvation, many held without access to legal representation or communication with loved ones. The report examines how over 250 medical personnel were detained between October 2023 and September 2024. 16 of them died while in Israeli custody, and more than 180 are still in custody at the time of the reporting. Some detainees went unvisited for over 6 months by legal teams or family members. In this episode, we'll dive deep into key testimonies, the legal framework they challenge, and the broader implications for human rights in the context of ongoing conflict. Hello, Maha, and thank you for joining us. Maha, this is a very complex and sensitive issue. Under international law, medical personnel are meant to be protected, especially during times of conflict, mainly because of their critical role in saving lives and their commitment to neutrality. The reported detention of so many medical personnel under inhumane and harsh conditions, and the thought that they were targeted for their medical profession is really horrifying. Can you please walk us through how this started, what motivated PHRI to produce this report, and what does the report reveal about Israel's approach to Gaza's medical system?
Thank you for having me, Haya. So, what motivated our department to produce this report were patterns which we first started noticing with the first Israeli incursion into Al-Shifa hospital back in December 2023, which marked a start of a systematic campaign targeting medical personnel in Gaza during the ongoing genocide. So that raid involved mass arrests of Palestinians, including hospital staff and the director of Al-Shifa Hospital, Dr. Muhammad Abu Salmiye. What followed was a clear and disturbing patterns. We're talking repeated attacks on medical facilities like Al-Awda Hospital, Kamal Adwan Hospital, and Nasser Hospital, and also a second wave of arrests at Al-Shifa in March 2024, and renewed raids on Kamal Adwan Hospital between October and December of that year. So these mass arrests devastated Gaza's already fragile healthcare system. It quickly became clear to us that the deliberate targeting of healthcare workers wasn't incidental, but instead it was a core part of a broader strategy to dismantle Gaza's medical infrastructure, essentially. That's why we decided to focus our attention on the detention and treatment of healthcare workers in order to investigate and document what was happening and to expose those patterns behind it.
This is an incredibly sensitive issue to investigate and requires a sensitive approach to the process of collecting testimonies. Can you tell us more about the methodology that you used and what kind of challenges did you face in gaining access to such deeply personal and traumatic accounts?
So like you said, the information was indeed very sensitive, and it also was very fresh trauma. So when we started thinking about how to gather as much information as possible in the most successful way possible, while knowing the kinds of obstacles we'd face from the Israeli prison system and Israeli military, we decided that the most effective approach would be to create a structured questionnaire. The idea behind this questionnaire was to help healthcare workers tell their stories in a clear chronological way, while also being and remaining as sensitive as possible to the fact that they are still dealing with recent and ongoing trauma. So the questionnaire covered a range of areas, from how they were initially arrested to the conditions they were held in, what happened during interrogations, and the state of their medical care, which included both pre-existing conditions and any new health issues that developed as a result of their arrest and detention. And as expected, we ran into serious delays when trying to visit detained healthcare workers held in the IPS and military camps. Legal visit requests could take up to months to get approved. And even then, some were canceled at the very last minute, sometimes even after the lawyer had already arrived at the detention site. So these delays were incredibly frustrating, especially given how urgent the situation was and still is, considering the dire conditions these healthcare workers are being held in. And we already had a sense of how atrocious that reality was, with insights from whistleblowers, reports from other human rights organizations who were able to visit Palestinians in Israeli custody generally, and those from Gaza particularly.
You mentioned whistleblowers, and I want to continue on that point. The report mentions that even medical personnel were complicit in the violations, meaning from the IPS side. What role did the doctors and prison medical staff play in these conditions, and how did PHRI receive information from these whistleblowers?
So the complicity of medical personnel was very clear through the violations we documented through our report. For example, at Sdeit Iman, there were cases where doctors reportedly performed amputations without anesthesia. We also heard testimonies that medical students were allowed to quote-unquote practice on those detained, basically treating them as subjects of human experiments and not actual patients in need of medical care. Beyond that, medical care in general was often denied altogether. Medical care in general was often chronically ill. One doctor we interviewed shared that when he pleaded to the prison doctor to treat him humanely, appealing to their shared profession as physicians, the doctor instead slapped him and called him a terrorist. And this wasn't an isolated incident. Across both IPS facilities and military camps, essential medical care is routinely withheld. Injuries go untreated or are left to deteriorate until the only remaining option is extreme measures like amputations that could have been prevented if proper and timely medical care was given. So the medical neglect combined with the dehumanizing attitude shown by the medical staffs within these facilities reflect a deep and disturbing level of complicity. It doesn't stop with individual doctors. This approach is reflected across the Israeli medical establishment. For example, when international medical associations called on the Israeli Medical Association to condemn the targeting and arrest of Palestinian healthcare workers, the IMA did not only refuse, but went a step further. They responded by labeling these healthcare workers as terrorists or terrorist sympathizers. And just to be clear, these people, much like Dr. Hussam Abu Safi, like Dr. Muhammad Abu Salmi, and hundreds of others, were never accused or charged with any crime. So this kind of rhetoric has been repeated by the IMA over and over again since the genocide began. And we see its consequences clearly. You know, the effects of that rhetoric are painfully evident in how Palestinians in Israeli custody are treated by medical staff in the IPS and in military camps.
What do you think these testimonies reveal about the unwritten directives, unwritten policy of the targeting of medical personnel? And also, what do they reveal about the reason behind this targeting?
Through the testimonies, you can see a clear pattern of systematic abuse against Palestinians in general under Israeli custody and against Palestinian healthcare workers specifically. Some of these practices were so routine, they've been given official names by those detained. So one example is something that is referred to as the welcoming, or in Arabic, tashrifa, which is sort of like a kind of ritualized abuse. So a tashrifa refers to the extreme violence inflicted on those detained upon arrival to a new detention facilities. So after transfer. This includes severe physical assault immediately after entering the new facility. And every healthcare workers our lawyer has interviewed who had been transferred described experiencing the welcoming. Another thing would be the use of an interrogation room that was referred to as the disco. In this room, those detained were subjected to severe sensory overload. That is loud music, that is bright lights, that is constant banging. And this was designed to induce a sort of sleep deprivation and to exhaust them between interrogation session. One more thing that stood out would be the forced ritual, so to speak, of greeting the quote-unquote the captain, or that is the quote-unquote the captain count, or patrolling, and so on, with phrases like good morning, captain, good night, captain, thank you, captain. And at first, this might seem as a significantly less horrific concept than al-tashrifa or the disco rooms. But taken into context, these captains are often the same soldiers who carry out the welcoming beatings or are present in the disco rooms during interrogations. They are essentially associated as the inflictor. So this constant forced ritual becomes a form of intimidation and humiliation, and it's sort of a way of asserting superiority. So if you take all of this, along with the fact that many healthcare workers through their testimonies have said that they have received more severe beatings when the soldiers knew that they worked in the medical field. For example, a dentist was, after they found out that he was a dentist, he was severely beaten on his fingers while the soldier told him, you will not be able to go back to working with your hands after I'm done with you. So all of this put together point to a systemic yet unwritten policy that is intentionally harmful and intentionally abusive by design. And what makes all of this even more disturbing is that these testimonies are coming from medical personnel. We're talking about people that are not only being unlawfully held in detention, that is by international humanitarian law standards, but who, in the middle of an ongoing genocide, are urgently needed in their positions in the hospitals. These are professionals who should be treating the massive numbers of injured civilians, the hundreds of thousands affected by the immense humanitarian crisis Israel has created over the past year and nearly 10 months. They should not be held in military detention camps and prisons where they're being actively and persistently tortured and humiliated.
This targeting, this special treatment, so to speak, of medical personnel and healthcare workers. I mean, usually Israel justifies its administrative detention by security reasons. Mm-hmm. And here we can see that these medical personnel, they were not really interrogated on actions that they might be complicit in. They weren't interrogated about things that they did or but it seems like they were targeted for another reason. Can you talk more about that?
Yes, through the testimonies that we've gathered, we've also asked about the interrogations. And what we came up with is that medical personnel, in most, if not all, interviews that we had, were not asked about any involvement in criminal activity, but instead they were asked about the building of the hospital, where the rooms are, where the generator is, the structure of it. They were asked about their colleagues, what their colleagues do, and so on and so forth. So it seems that they were interrogated for information gathering rather than investigating their involvement in criminal activity.
Or preventing involvement.
Mm-hmm. So, yes, and it's also evident in the way that none of the 24 healthcare workers that we interviewed, and also post publishing the report, none of the health workers we interviewed in general were accused of any criminal activity, but instead their detention is just being prolonged for no apparent reason. They are told that they don't have any charges against them, but their detention will be prolonged until the end of the war, which kind of gives the idea that
they just don't want them there.
Yeah, Israel is just not investigating any criminal involvement. They are just essentially holding them hostage. They are not able to provide the healthcare that they're supposed to provide back home, back in Gaza. And that seems to be the reason.
And how does Israel justify practices?
So when we look at the staggering number of testimonies detailing flawed legal procedures, confessions obtained through coercion, no criminal charges being filed, and just a completely broken process, both legally and from a humanitarian standpoint, it's clear that serious obligations are being breached, and that's true even if these individuals have committed a crime and even if charges have been filed. So Israel it seems to have a clear approach of criminalizing Palestinians in general and Palestinians detained from Gaza in particular. And even more in particular, Palestinians from Gaza who are involved in the healthcare system in Gaza. So that mindset came through strongly in the testimonies of healthcare workers. it's this idea of even though there are no charges filed, we'll keep you in detention and treat you in a vengeful way, sort of, because to me you're a terrorist who deserves this torture. And this can be also very clear in whatever little responses we received from the IPS and the Israeli army. For example, the IPS made it super clear that the limited food provided to detained individuals is, in their view, sufficient, and that quote-unquote terrorists don't deserve things like fruits or vegetables. The military, on the other hand, claims to be investigating certain abuse cases, which also includes the, let's say, infamous sexual assault case in Staved against a Gazan detainee. And although they claim to be investigating those cases, those same abuses continue to happen. So the message we're getting is that nothing real is being done to stop or prevent the abuses. We and other human rights organizations have uncovered in many reports, and the sole justification seems to be that, again, these people are terrorists or terrorist sympathizers.
And for nearly 2 years, no independent third-party observers, not even the International Committee of the Red Cross, were granted access to the detention facilities. Is that right? What does that lack of external oversight mean in practice? How was it implemented, and what does it mean for the detainees and for efforts to hold authorities accountable?
Yes, so October of 2023 marks, I think, so I'm pretty sure, the first time that the Red Cross was not allowed into Israeli detention centers or detention facilities. You know, the role of the Red Cross is very crucial when it comes to oversight. So the Red Cross can go in and have their own checks and insights on everything we've talked about in our report, about the abuse, about the torture, about the medical neglect, about the starvation, and so on and so forth. So the prevention of the Red Cross to enter detention facilities showcases not only a deliberate failure to ensure humane treatment and the deliberate failure to uphold legal protections, but also it confirms the complicity of Israeli authorities in breaches of international law and national law at that, and just highlights the abuses of human rights in a way that there is no third party that is oversighting these incidents. And again, these are not isolated incidents. These are incidents that are reoccurring over and over and over again. And there is no party instead of the occupying party, let's say, that is allowed to have any sort of oversight or information about these abuses. So yes, the prevention of the Red Cross essentially confirms the complicity of Israeli authorities in these abuses, and showcases that they are not only they are not willing to stop it or prevent it, they are not interested in any third party of knowing of these abuses, and how they go about and why are they still happening almost 2 years into into the genocide.
Let's continue on, international intervention. I assume that one of PHRI's motives in producing this report was to lead to some sort of international intervention. What impact do you hope that this report will have, and what kind of impact, if any, has it had so far? on the ground or in the diplomatic arena?
What we really hope this report does is hit a nerve, especially with healthcare providers, with colleagues in the profession, so to speak, who read it and take in the testimonies it's based on, and truly delve into what is being done to healthcare workers unlawfully till this day. Our hope is that it pushes for real, much needed action, that it sparks pressure, global movement that is demanding justice, that healthcare workers, one of the most crucial groups operating in Gaza right now, are immediately released so they can continue their life-saving work, and that those complicit in their torture and in the torture of others are finally held accountable for these abuses. With that being said, while the impact is slow, it is happening. You can see for example, the British Medical Association have called into sanctions on the Israeli Medical Association, sanctions on the in the human rights abuses that are happening in the IPS and in military detention camps. And while it is not enough, it's something, and it's something that should be stressed, and something that should keep happening, because international pressure, as we have noticed, for example, from the case of State Iman, it was international pressure that pushed Israeli authorities to have some sort of action, as little as it is, but some sort of action that without international pressure it would not have happened, in order to try and stop the abuses within State Iman. So it is very important that this kind of pressure continues, especially when it comes, like I said, from healthcare providers, from colleagues in the profession, of those detained, to keep pushing for real action, for much needed action, for pressure, for movement, global movement that would, at top, would demand the release of every single healthcare workers held unlawfully in Israeli detention.
And from a legal perspective, what violations are we looking at here? And what are the breaches of international law?
So the report documented several breaches of protections granted under the Geneva Conventions and other recognized international human rights treaties. That was not only in the treatment of medical personnel, who are a protected group by international law, but also in the broader treatment of detained individuals. We identified at least one violation of international law in each of the report's two main areas of focus. One area was the examination of the detention itself. The arrest of medical personnel in itself already constitutes a breach of several articles of the First, Third, and Fourth Geneva Conventions, which guarantees protections of medical personnel in ensuring their vital medical work is not hindered. The Israeli authorities' conduct of interrogations breached protections against cruel treatment, in which coercion was used to obtain information, which is in direct violations of protections in the Fourth Geneva Conventions. We also have the flawed legal procedures, which breach protections under the International Covenant on Civil and Political Rights. That is against arbitrary arrests, the right to legal consultation, and the right to a fair trial. So that was our first focus point. The second focus point was on cruel and inhumane conditions, in which we examined breaches regarding abuse and torture, starvation, and medical neglect. In these, we found about 8 different breaches of articles under the Geneva Convention, and in regard to ill treatment, torture, and provision of adequate care for detained individual, and even one breach, which was regarding medical care in the unlawful combatants law itself. So these breaches concluded that there was, again, deliberate failure to ensure humane treatment and also to uphold these legal protections. And we're talking both national and international law, which, when you combine it with the oversight we spoke before, with the Red Cross being prevented from entering these facilities, it reinforces the complicity of Israeli authorities in these breaches. And it showcases not only this consistent, systematic sort of approach that is riddled with abuse and torture and medical neglect that goes against almost every single human right given to individuals in general and to detainees in particular.
This, unwritten policy that targets medical staff in detention centers is not out of context. It's part of a wider approach targeting Gaza's healthcare system in general.
Yes.
Can you say something about that?
That is very true. When the genocide started, there was a clear intent of the criminalizing and borderline dismantling of Gaza's healthcare system. So you see it in 2 ways. The first was to destroy the infrastructure, the hospital buildings, the medical machines, the prevention of entry of medicine, essential, there was this part. And then you have the part where you empty the hospitals out of their staff, which, you can, a doctor can perform, okay, we're not talking like huge operations and whatnot, but a doctor can perform or can provide medical care not in hospital facilities. They can provide it in a tent, for example. Maybe not as efficiently, but they can. So I think this propaganda of criminalizing, of delegitimizing the healthcare system was really thought through, first of all, through the destruction of infrastructure, and second of all, through emptying the hospitals of its staff. And this becomes clear also, again, because healthcare workers are not being investigated for criminal activity. They are being asked about hospital structures. Every hospital that they went in, almost every hospital they detained the head of the hospital, the director of the hospital. So you can see that there is clear intention of destroying or dismantling the healthcare system in Gaza in a way that it's completely unable to continue, whether it's by its infrastructure or whether by its staff.
Okay, we got to the final part of the moving forward. What message do you have for the people listening to us? How can they support the work that PHRI is doing right now and to amplify these findings?
So there's still so much to be done, amplify the voices in these testimonies, share their stories, share their suffering, contact your local medical associations. There are thousands of Palestinians in detention whose experiences mirror those we've highlighted in our report. I would ask to make their voices heard in any way you can, to demand their release, to demand accountability. It's the very least we owe to those who have suffered through all of this, just simply for trying to fulfill the duties that they took an oath, basically, to uphold.
Thank you so much Maha, for all the work that you did on this report and for being with us today.
Thank you.